2.5. The thing is, I don't know whether he doesn't want to say the words or he doesn't know how to say it. For example, okay, first of all, he has limited vocab. First of all, for example, like when we ask him to say certain words, for example, say ball, he will say maybe just once. And then after that, when we ask him to say again, he doesn't say. So there are certain words which he will say often. There are certain words which we only heard him say once or twice, that's it. And he never say that anymore.
But otherwise, his other developments are okay?
Yeah, other developments is okay, but sometimes when he goes to the playground, he see...
And sorry, he's 4, is it?
2.5.
Oh, 2.5.
Yeah, he doesn't really like crowd and he doesn't like people that he doesn't know. For example, when he goes to a playground, if there's nobody, he loves it. He will just go and play. But when he sees people coming, he will tend to just retreat.
Okay.
Yeah, and he just play with people that he knows.
Okay, it's really hard for me to diagnose in this way because I need to actually see the child and assess all the different parts of his communication. I don't want to be telling you something and it's not that because I can't just give a diagnosis like this. But there could be a lot of reason why your child is not repeating the words many times. Some child might need to hear a word once before starting to use the words, but some children need to hear words all the time in order to start using them in their everyday life. And in terms of being shying away from crowd and all that, I mean, it could boil down to personality as well. But I'm not saying that it might not be other things. It could potentially be other things, but we wouldn't know. I wouldn't be able to give you an accurate diagnosis unless I go through the entire assessment with your child.
Because he behaves differently when with a stranger, so my concern is if I were to take him to an assessment, will it, because he doesn't respond, or rather he's scared of strangers. So I don't know whether when going through the assessment, he will be like natural, his own natural person, or he just wouldn't respond.
I understand what you're saying, but a lot of the assessment also goes through parent interview. So there are lots of parts to it. It's not just interaction with the child. It's also getting a lot of information from you as well. So we collate this information together to make a sound diagnosis.
Hi, I'm Elise. Good morning. I'm interested in over here.
Oh, okay, sorry. I'm like,
yeah, I'll be pursuing a degree in speech therapy this September. If everything goes well. I just have 2 questions. One, in a multilingual country like Malaysia, how would be the best way to tackle? Is the best treatment to only settle for one language? Like you have to decide if you want English or Malay or Mandarin or Cantonese. Is that the best?
Usually we go by primary language. What's the language that they speak the most? But we also do therapy in dual language. Like if you're able to speak multiple languages. Let's say if the therapist can speak those languages and the child can speak those languages, then it should not be a problem to do therapy in both languages because all the therapy methods translate across all the different languages. And we do have different therapists that speak different languages here as well. So like Tamil, Mandarin, Malay, English, those things. Myself, I do my therapy in Malay and English.
Okay, second question is, I've read an article that Malaysian speech therapists are headed towards family-oriented therapies. How updated is that piece of news? Are we still headed in that direction?
Family-oriented therapy, what does that mean? Sorry?
The therapist not only trains the child, but also empowers the parents and their siblings, because the parents and siblings are at home all the time, so they will have the most interaction.
Well, these are the roles of a speech therapist anyway. Like I mentioned earlier, it's not just about the child, it's also about everybody around them. So this has been happening, even if you go through speech therapy as a course, you should be doing this anyway. Yeah, so it's not just a one-to-one therapist and child. It's about everybody to support the child. Yeah, you're welcome.
Parents, they ask us, I spoke at 3 years old, so why should you bother, to ask me to go for assessment? And they are somebody they can, quite professional. So do we just take it or we still push them to go for assessment?
You should push them to go for assessment because not every child is going to overcome it on their own. Yeah, and even for yourself, it's like imagine how much better you could have done if you were being helped at a younger age as well. Yeah.
Hi, my name is Aina. I'm a parent and a teacher as well. So my question is on behalf of the team at school. We do come across a number of children who have speech delay, and we are not trained therapists, but what are the activities that we can do at school with the children, whether it's on group basis or one-to-one with the child? What are the things that we can do with them to get them to enjoy talking or start talking with a clearer pronunciation?
Okay. You know all those language strategies that I gave in there? You can do any types of activities with an element of that. So let's say if you want to teach turn taking, right? This is where creativity has to come in, right? So let's say in your mind you tell yourself, okay, for today I want them to learn a lot of turn taking. So build activities around turn taking, and then you can even add all those components together. Let's say you want to do turn taking, language, and eye contact, and all that. So you can play games that are directed towards that. For example, you can be in a group, and then maybe you can hide things in bags, and then pass it to one another, and then they have to talk while when it's their turn, and they have to wait, and then those type of games that
We're actually already doing all those, but it's
great.
just more of like, let's say I would pull one child out and have a 10-minute or 15-minute session with a child daily. What are the things that we can do? Because I have one or two kids who, how do you say it? The muscles seem to be tense and they don't pronounce the words as a whole.
So it's more
like
a
ball as ball.
Okay, so it's more of a speech problem, right? Not so much the language, right?
Yes, you're right.
Okay, then you can do things like be in front of a mirror maybe, and like stick your tongue out, do different facial expressions. This is to get more awareness of your articulators, and then you can copy some sounds. You can play games where maybe you have like a sound, a phonics, and then maybe you stick a picture every time you make a sound, those type of things. And repetition is key, so to do drills. So maybe have like, let's say if you're working on the sound B, or you want to work on the word ball. So maybe you can even have a game, like, get the ball and then throw it into, every time you say ball, he gets a ball and gets to throw it in the basket. Or something like a reward, or like a reward thing. Yeah. Or you can also play like barrier game. So get the child to say a word, and then maybe you draw it out and see if you got the right word. Like if they say it and then you draw it. But then if they don't say it correctly and you're like, oh, I'm not sure what you said, so I can't really draw it. Things like that. So a lot of it you have to be quite creative. You need to know what you're targeting, what sounds you're targeting, what type of language you're targeting, and then build your activities around those.
Could you recommend some free online resources that you could look into?
There's a lot out there. I think even if you type speech therapy materials, there'll be quite a few websites that will come up on your search, and it will have a lot. They have a lot of free things as well.
Okay, cool. Thanks so much.
Hi, can we have one last question?
Thank you very much. For an adult with a low self-esteem who is stuttered, what would you recommend?
Adult stuttering therapy is actually a separate thing, and it's quite difficult actually to change an adult's behavior. So you have to go through quite an intensive program. So, and it's not really my scope for the adult stuttering thing, so I will not comment on this. But maybe you can engage somebody that can do, again, a full assessment and give recommendations from there.
Actually, he's a professional man, but because he's been treated badly at home, you know, they belittle him and things like this. So I guess it has a lot to do with his low self-esteem. But the family is not very cooperative.
I see.
And I was just wondering whether I should need to go and see a pathologist.
Well, that would be a good start. If you feel like the problem is not so much the stuttering stems from an underlying cause, like esteem issue and all that, then yes, definitely you should address those key issues. Yeah, you're welcome.
Thank you, ladies and gentlemen. If you have any other questions, you can approach Ms. Aina later after the session. With that, we have come to the end of today's StarLIVE session. A big thank you to our speaker of today, Aina Elias. Also, we would like to invite all of you to be part of today's StarLIVE. Before you leave, we'd appreciate if you can fill in the feedback form in the folder. You can leave it on the table outside. Be sure to look out for details on the next StarLIVE in the Star newspaper. Thank you and have a nice day.